Hi, I'm Dr. Monica Chadha. I'm a chiropractor and movement coach. And to carry on our discussion of Mental Health Awareness Month this month, I really wanted to touch base on a fact that I kind of learned today when I was looking up how many Canadians are impacted by mental illness. And it's 1 in 3 Canadians. And that number to me is quite alarming. I was really shocked to realize that. And that's about 9 million people in our country. And when I looked up how many adults are impacted in their lifetime in the US, that's 1 in 5. So these numbers are quite large. Basically, if you look beside you and there's 3 people with you, at least one of you is suffering, and that says a lot. And so I think it's really important to talk about what we can do, not necessarily to completely combat it, but maybe even to just cope with those hard times, and especially in moments when we're not experiencing the hard times, how we can build up our reservoir to be able to combat those really tough moments. And if you're someone that tends towards mental illness or mental health disorders, I feel like some of these pointers may be really helpful. So leave me some comments. Let me know what you think. Let me know some ideas that you have as well. I feel like many people can benefit from sharing here. And when I look at mental health from a movement perspective, it's vital that we move our bodies. And most of us know this, but we may not really understand why. And the major reason from a brain chemistry point of view are our endorphins. And so those are things like our serotonin, dopamine, and norepinephrine. And these neurotransmitters are vital in keeping in helping us when we exercise. These are modulated in our brain to help us, feel that happiness, that excitement, or to regulate our thought processes and our neurochemistry, and also to regulate our mood and our ability to be excited, our ability to feel calm, and our ability to feel motivated to do something. And so I think it's super important to understand why exercise is recommended as a coping mechanism for things like depression or anxiety, or anyone that really is impacted by a mental health illness. And so, when I look at it for myself, when I look at it for my patients, I can see when they go out and move their bodies, when they're exercising, that immediate rush that they feel afterwards of feeling better for doing it. I don't really hear of many people that feel bad about exercising afterwards. Obviously, if you've suffered from an injury, that's another story, but hopefully you're not injuring yourself during your workouts. I do think it's really a key component to, in addition to other things that you do, like, taking medications or having talk therapy, or taking supplements or whatever else you do. I think we shouldn't be ignoring the powerful component of exercise and movement. So what I would encourage most people to do is at least getting 30 minutes of movement a day. And this can be as simple as going for a walk. It could be as simple as doing a bike ride, whatever method of movement, dancing around your apartment, dancing in between cooking or getting ready, strength training, whatever it is that brings you joy when you move your body. I would really amp that up as much as you can. Also sprinkling in some movements that might not necessarily bring you joy, but you feel good about doing them afterwards, that also benefit your health, would be great additions to your movement routine. Some other things to consider is the importance of vitamin D. Obviously, our naturopathic doctor would give you a whole slew of information on that. But vitamin D is really a great vitamin to take for anyone that suffers from mental illness, and you can get specificities on that from your medical practitioners. But another way to get vitamin D other than supplementation form is to get outside. And so a lot of times when you're able to, I encourage you to move your bodies, but maybe even go outside and move your body. So go for a walk, go for a sprint, a jog, a run if you can, or just stand outside, enjoy some sunshine and breathe and take in the fresh air. All of these things have huge impacts in a positive way for our mental health and our overall health. If you have any questions, I really do hope you reach out. If you have suggestions on things that have worked for you to improve your mental health and to help you cope with mental illnesses, that you've done, such as exercise or supplementation or anything else that you can think of therapeutically that you'd like to share, please drop it in the comments below. Feel free to message me on the side as well, and I'd love to chat with you. Thanks so much.